When you eat food, it doesn't typically release dopamine in those reward regions. It's really only the very first time you eat a new food, and that has more to do with dopamine signaling as a part of the learning process. But when you take high sugar foods, that's a very different story. It releases dopamine like a drug. Stress is one of the biggest contributors to overeating, and a lot of people will turn to sugar-rich foods as a way to self-medicate their stress and anxiety. People find themselves trapped in where they get stressed, they go to sugar makes them feel better, they get stressed again, and they keep going back and back. When you have control, then you're free. When you don't have control, then you're a prisoner.
Welcome to Five Rivers Podcast. My guest today is Dr. Nicole Avena, neuroscientist and author. And Dr. Avena, I must tell you, I am super excited to get a chance to speak with you. I have followed your work. I've seen some of the videos that you've done on social media. I saw the TED Talk; it was incredible. So thank you for all the work that you've done in this space and continue to guide people in the right direction. Welcome to the podcast.
Oh, thanks so much. I'm very happy to be here.
So you've been a pioneer in showing how sugar doesn't just affect your body. It changes how our brain behaves. Why are we wired to crave sweetness, for lack of a better term?
Well, it's really interesting. When you look at the evolutionary history of humans, we actually were designed to crave things that are sweet because in nature, if you think about it, things that are sweet are usually good for us. So, for example, if our ancestors were, wandering the forest and looking for berries to eat, you would want to eat the berries that were ripe and tasted sweet. Those are the ones that are safe and good for you and going to be nutritious and have calories and sugar. You wouldn't want to eat the ones that were sour, the ones that fell to the forest floor that had mold on them. Those are the ones that are going to make you sick. And, beyond just sort of our environment, even when we're born, the very first thing that most babies taste is breast milk, and that tastes sweet. And so we have this sort of biological propensity to code things that are sweet as being safe. And that may have served us very, very well for thousands of years. But, when we look at our modern food environment, it's actually a detriment to us because we have this craving for sweet and this desire to eat things that are sweet. But the sweets these days are very different than the ones that we were evolutionarily brought up to be attracted to.
So from the evolutionary perspective to where we are right now, how has the mismatch, if you will, between the natural sugars you talked about, or fruits, and from an ancient perspective, and current, how has that mismatch sort of rewired our response, our brain, our reaction?
Yeah, it's interesting because we still have those primitive brains, even though we've evolved. We really haven't evolved that much. I think our environment's evolved a lot faster than our brains have. So we haven't been able to adapt to our changing environment when it comes to our food. And so that's why it's really hard to resist these different types of ultra processed foods, these sweets, these convenience foods that basically are now a staple in the American diet. And so, we have that desire to, overeat the berry bush when we stumble upon it in the forest because we don't know when we're getting a berry bush again, right? We don't know when it's going to be in season again, right? I mean, so we would have access to sweets, in a way that was controlled in such that we didn't have this unlimited access to them. So it was okay to overindulge and to overeat. But nowadays it's not. And now we see that, so much of our food supply is really just inundated with a lot of these types of foods that we know are bad for our health, because not only is it just eating too much of this refined sugar, but it's also the health ramifications that come along with that. So in addition to things like obesity, we also see increased rates of cardiovascular disease, diabetes, really just a variety of different medical complications that we now are seeing are in many ways rooted in the poor diet that we're consuming.
So would you say from a biological perspective and chemical reactions within the body, for example, and we've done some research on this as well. I think there are plenty of papers out there, but is there a tie-in between the dopamine effect, if you
Mhm.
will, and the consumption of sugar when it comes to people's sort of addiction, if you will, for lack of a better term?
Yeah. So way back when I was a graduate student, I was a grad student at Princeton, and I was fresh there, just started. And when I was meeting with my advisor about what I was going to be doing for my dissertation for my PhD, we started talking about this idea of, how come so many people are struggling with obesity,
Mm,
even
mm,
though
mm,
there's lots of advice telling people don't overeat, don't eat too much, junk food. And so we started down this path of asking the question, well, can sugar be addictive? And
mm,
so really that was one of our first studies, was to see if when we give laboratory animals, in this case,
mm,
sugar, does it cause an increase in dopamine release? And what we found was that yes, it did. And that increase in dopamine release was more like what you'd expect to see with a drug. One of the things that makes drugs so different than food is that every time somebody uses a drug of abuse like nicotine,
mm.
morphine, cocaine, you name it, it releases dopamine in the reward related regions of the brain. That's really the
Got it.
hallmark of drug use. Food doesn't do that. When you eat food, it doesn't typically release dopamine in those reward regions. It's really only the very first time you eat a new food. And that has more to do
Mm,
with dopamine signaling as a part of the learning process, and just, making sure that this food doesn't make us sick and being aware of our surroundings. But
mm,
once you're accustomed to eating foods, they don't typically release dopamine. But when you take high sugar foods, that's a very different story. It releases dopamine like a drug. And so that was really the beginning of our understanding of this concept of sugar addiction and food addiction,
mm,
and showing from a neurochemical standpoint at least. And we've combined that study with lots of others that we've conducted and others have conducted that have contributed to the other aspects of addiction that can emerge in response to food, to really kind of paint this picture of, yeah, well, it does seem as if sugar can produce signs of addiction. And when you think about that in our modern food environment and all the sugar rich foods we have and all the people that are struggling to regulate their food intake, it explains a lot in terms of why people struggle with that.
yeah. It's interesting you say that, because to us, what we've seen with a lot of our members, with the folks that we work to, is the redefinition little bit too, right? That it's not necessarily just a weakness. It is the wiring that you talked about. It is the response to something that's naturally inherent to human beings, and working with them to help them identify, understand, and, for lack of a better term, give themselves a little grace to say, hey, there are different ways to get to it. There are different ways to solve the problem, but it's not just a simple matter of, man, I am so weak, I can't stay away from sugar. Well, there's an underlying current there underneath that you have to get to the bottom of it. So I truly find this very fascinating. To your point earlier too, that the response, the body's response, and the dopamine receptors and those firing off, uh, like a drug,
Mhm.
right? And obviously the food industry, the industry that uses a lot of sugar and processed foods and things like that, they've done a phenomenal job of making sure they make it worse and worse and worse, and take the labels and make it so much more confusing for people to just get it right off the bat to say, no, 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 this is not good for me. Time out. This is going to cause me an issue, or it is going to help make me go down a path that is not sustainable or adverse for me. And it's frustrating.
Mm.
Our hijacked brains, for lack of a better term, have no other way but to really dig deep and figure out how we can get over this. So in theory, I mean, that what I was trying to explain, or what I was trying to confirm, is that it's a neurochemical surge. Would that be accurate statement?
Yeah, absolutely. And what you're saying about, the fact that it's not a willpower issue. It's not a moral failing because
Mm.
people can't control their food intake. I think that's really important for people to learn about and to understand. That's why I really enjoy talking about the research and the science that's gone on
Yeah.
in this space, because I think when people hear that, it does help them to see that,
Mm.
yeah, when I'm reaching, for those treats and the cakes or whatever it might be, it's actually my brain having this like firework display in response to the packaging, the pretty colors, the
Right.
memory of the taste of those foods. That's all happening in your brain, and it's driving you to then want to eat more and more of it. And
Yeah.
I do think that the food company in general has done a really good job of still convincing us that it's our fault and telling us that, well, you got to exercise more, and, well, you should just eat it in moderation. Like,
Yeah.
we have the serving size is like, 7.5 chips. And like, who's going to eat 7.5 chips? Like, nobody counts these things out. So there's been a lot of, I think, um, you know, discussions in the food industry around like, okay, yeah, we're trying to get ahead of this. We want to make it look like we're, doing everything we can to protect our customers and keep them healthy. But, the work that they're doing, I don't think is actually working in terms of helping people
Yeah.
to make better choices. I think if anything, like you said a few minutes ago, it's just adding to the confusion, and it's really not being as transparent as they need to be. If you go to other countries, you'll see warning labels on
Yep.
processed foods. If you go to Mexico, some
Mhm.
European countries are starting to do it now. Um, and again, I'm not saying that the warning labels are going to cure us of all of our
Right.
problems, but it does give pause. And I think it does, just like with tobacco products, like it helps you to kind of maybe think twice before you
Yeah.
decide that you're going to start using that, or you're going to use a lot of it, or buy it, or bring it in your home. So I do think that there's more that can be done to help people to kind of get rid of a lot of the confusion and the ambiguity around, whether or not these foods are actually healthy for us or not.
Yeah, and I think the food industry has done a phenomenal job of exploiting, that messaging,
Hmm.
right? And they're masters in communication. That's the way I
Yeah.
see it. The way they position themselves, the way they call healthy alternatives. We travel, as I was mentioning earlier, we travel a lot, and going to a lot of these, we traveled to Latin America earlier this year. We were in Japan over the summer as well, Japan and South Korea, and we realized, I mean, there are plenty of uh, access. There's plenty of access to sugar in
Hmm.
these countries, no doubt about that. And human beings, to your point, they're also predisposed to wanting some of that.
Hmm.
But we find people are still healthier in those countries. People are still behaving in a more responsible manner because, first of all, they've got the understanding, they've got the education about the ill effects of sugar. But then the industry has done a good enough job from a responsibility perspective and say, hey, whatever we do make, whatever we put on shelves, whatever we put in packages, it better convey the right message and also be in moderation enough to not
Hmm.
have those spikes, not have those craving centers fire up left and right. And yeah, I'm glad you brought that up because I was thinking about that. I was like, man, why is it that people over there have the same access,
Yeah.
yet we as a society, us as Americans, we're struggling more than any other country. But I guess that's a much longer systemic discussion to worry about.
Yeah, I do think there's a cultural piece to it too. I do think that in a lot of other countries, people are very much wedded and dedicated to their food culture and the
Mm,
traditional foods of their culture.
mm,
And that's where Western influence is starting to become problematic in many countries. I know, for example, a couple of years ago, I was invited to speak in China to an organization there that was concerned about the fact that many of the younger people in China are not cooking traditional Chinese food at home, which has been,
yeah.
a big part of their culture. And with the influx of, fast food and a lot of this Western influence in terms of processed food, it's changing the composition of the types of foods that people eat. But I think if, you look at America, I feel like our cultural identity is junk food. I mean, I feel like it's become that. And I
Yeah.
don't think that we have as much allegiance to, home cooking and maybe regionally we do in certain parts
Yeah.
of America because, America's a very regional country. But I don't know. I just think that that's a big part of it, that we don't have that sort of historical tie as a
Mhm.
nation to, eating healthy and these sort of foods that, we know are nourishing and a big part of our history and culture that other
Yeah.
countries fortunately do have. I think that's helping them.
Yeah, it's interesting you said that. So I grew up in India, and growing up, when you were traveling, when you were out with your family, mom, dad, me, and my brother were traveling, and you got hungry, and I told mom, "Hey, we need food. I'm hungry." There was no, "Hey, let's just take this exit, go grab a burger and fries, and we're
Hmm.
good." It's like, "Hey, I'm gonna cook when I get home, and when I get home, we'll cook a meal, and we're gonna have the meal, right?" So first of all, you learn sort of that delayed. It's
Yep.
okay for me to be a little bit hungry. I can wait to get home. And second was when you got home, that's when you got the home cooked meal, and you stayed away from that. But the last few years, I've been going there for family trips or vacations or whatever the case might be. The prevalence of these fast food restaurants that have popped up, and the Uber Eats, and we're making access to this junk faster. It
Hmm.
was already fast because it was
Hmm.
called fast food to begin with. Now it's like, hey, not only is it fast food, but we can get it to you faster too. You don't even have to get off your couch and go get the food. We'll
Right.
bring it to you for you to get unhealthy. And as a result, I think at this point now, India has the second highest rate of diabetes
Yeah.
in the world, and it
Yeah.
continues to get worse. And I'm afraid that this trajectory, obviously, we've seen it in the U.S. already from an economic perspective. $400 billion problem. I mean, diabetes is a $400 billion issue for our society.
Hmm.
And then you start adding in some of the other factors and some of the contribution to other diseases
Hmm.
based on diabetes. My God, it is a multiplier that the magnitudes are enormous.
Yeah.
What's been your experience? What do you see in that, or what's your opinion on that as well?
Oh yeah. And it's, the thing is too, you don't if you diabetes can be well managed. People aren't going to die prematurely from diabetes. The majority of people are able to live a long and, you know long life with diabetes,
Hmm.
which means that they're going to have to manage that for the rest of their life. So we're talking
Hmm.
about people living into their 70s and 80s, and we're talking about a lot of people.
Yeah.
So, the costs alone of managing diabetes, managing the complications that can arise, and like you said, the contributions that we see from other conditions like heart disease,
Yeah.
all are really should be setting alarm bells off for countries, because to be able to support the health needs of a nation of sick people
Mm.
is really, I don't think, sustainable for any country. And so when we're talking like in the US, upwards of 60% of the country being able to be considered obese, and those numbers are just continuing to rise. We're seeing, the numbers among children are going up. The trajectory that we're on is very dangerous. And the thing that has been really frustrating for me as somebody who's been, studying this and doing research on this for a while now is that we have part of the answer right in front of us. It's really just about cleaning up the food supply and
Mm.
changing our mindset around what we eat and what kinds of foods we should be eating and promoting as healthy. It's not going to cure all diabetes. It's not going to get rid of all
Right.
cardiovascular disease, of course, but we could put a significant dent in it.
Yeah.
And, to me, that alone, I still don't understand why the insurance companies haven't picked up on that, and why there's resistance to doctors, prescribing, like fruits and vegetables, like,
Right.
having those be $3 to pay for when you pick them up, as opposed to paying a $3 copay for your medication that you're now going to have to be on for the rest of your life. So I do think that there is a lot that can be done when it comes to food that could help mitigate a lot of the suffering that we're seeing. And I do have concerns for countries like India and, other nations that just don't have the infrastructure to care for
Yeah.
all these people who are going to get sick.
Yeah. Yeah, no, it's interesting you said that because I attended a sort of a panel discussion conference this past weekend. I live in Dallas, and there was a state of diabetes that American Diabetes Association had put together, and there were a bunch of panelists on the stage, physicians, care coordinators, community workers, so on and so forth. And the biggest thing it kept coming back to was the conversation about nutrition, right? That hey, the ability for people to get the right education about nutrition and have then access to those nutritional options, right? The food deserts that we talk about, because
Mhm.
a lot of the lower income community, a lot of the minorities, for example, or the African American or Hispanic community, Indian community for that matter, we are already predisposed to being to have a high risk of diabetes. And then on top of that, if you take a low income subset of our American society and say, by the way, we know that you are at a high risk, but also here's some more fast food to go fix your hunger, right?
Right.
That's just it's Ouroboros, for lack of a, just a snake eating itself, right? It's just a never
Mhm.
ending loop. It just keeps going on and on. This brings me to the next topic, which we keep hearing over and over again: the GLP-1 drugs,
Mm.
right? And the GLP-1 drugs have become very, very popular.
Mhm.
There's been this new push for bringing down the cost, and I'd like to kind of share our thesis and would love to get your points, valid, invalid, from our thesis perspective. Would love to hear your thoughts. So, in our opinion, GLP-1 drugs, obviously, there are people, there are patients that need it, absolutely have a need for it, and should be getting it, but at the right cost, the right structure, with the right sort of protocol for the dosage and use of it. But it has become sort of a band-aid right now for a lot of people, and they're rushing to GLP-1 drugs to say, hey, I don't really need to change my behavior, I don't really need to change what I do, how I do it, because I've got this, in their mind, a panacea that can just cure all, right? And now with the drug costs coming low, but bringing it down again, which helps a lot of people, it should help a lot of people. But my fear is, all of a sudden we've made us even more unhealthy, because now we're saying, hey, guess what, remember that thing that was expensive, that might have been the reason why you didn't use it, now it's even cheaper, so you still don't have to do any effort. Now go enjoy your life, don't change your behavior, don't change your nutritional habits, because, well, here, there's this thing right there that can fix it. Is that what's your thought on that? How do you think about that?
Yeah, I agree. There's some concerns because I think that the drugs should not be viewed, no drug should be
Mm,
viewed as a panacea, right? I think
mm,
that, you know, like even if you have a fever, right, and you
mm,
need to take Tylenol to reduce it, all
good
right,
point.
you also need to rest. You also need to support your immune system because obviously your body is fighting an infection and you need to, get fluids. Like, so it's not like you just pop the pill and be on your way. You have to do the
Mm,
other things. And I think it's the same when it comes to the GLP-1 drugs. I think they're a tool that can be used along with other tools in the
mm,
toolbox. And I do think that if people enter the journey with the mindset that I want to change my behavior, I want to make healthier choices, I want to eat things that are good for me, I want to be able to indulge in little bits of sweets here and there and not have to
mm,
overdo it. If that is the mindset and that is the goal, I think that the GLP-1 drugs can be helpful to get people on track. They can be kind of like a tutor, if you will, because they're going to, just by the nature of how they work, not allow you to overeat. But I think, to your point, when people go in with the mindset of like, oh, now I can just take this drug and I don't have to do any of the work or any of the mindset changing that has to happen, that's dangerous because you could go to the pharmacy one day and they might say, we're out of your GLP-1 drugs, which is happening. I mean, you hear this all the time where, there's been shortages or, people like, have to fight with insurance about getting them to pay for it or things
yeah.
like that. And so I do think that, we do need to be better about educating people around the goal of this, which is to
Yeah.
be healthier. And yes, you could use these drugs as a foray toward that, but I really don't think that should be the end all. I think it really
Yeah.
should just be the beginning. And learning how to eat differently, learning
Mm.
the choices to make can be done. It's just a matter of a lot. And I think taking advantage of the fact that when people utilize these drugs, it kind of does give them that pause so that they can think twice before they go and overeat something, or think
Yeah.
twice before they, choose to eat something that's really not that healthy. So I think putting the mental work in with that is important. And I think more people need to do that.
Yeah, you talked about education or educating people about the responsible behavior. At the conference that I was at, and I'm looking at some of the stats that I came across, and one of the questions that ADA had reached out to people in their survey and asked them about what are the desired insurance benefits changes that you would like to see. The number one, the number one thing that people said at 58% was add coverage for diabetes education.
Mm,
So people are starting to wake up to this and say, "Hey, I get it that I have access to these drugs," and I'm glad that I'm seeing that the people are saying we need more education, but that's the probably the most foundational, fundamental thing that people need
mhm,
the empowered education to say, "Hey, what's right or what's good for you? What's bad for you? How does it affect your body? How do you overcome that?" Right? Those are all parts of education. And what if you go down this path? Where does that lead to? I think it was refreshing, and you echoed the same sentiment, which is education, education,
mhm,
education is a very, very key feature. Give our listeners a preview of the study that you're engaged in, and from what I understand, it explores how taste preferences can shape eating behavior. And please
mm,
correct me if that's not the right understanding on our part. And my question after the overview of the study is why taste, and how does it impact or
mm.
influence the long-term behavior, long-term health?
Yeah. So the study that you're referring to is a study that we've actually recently just wrapped up the recruiting for. This is a international study where I'm partnering with colleagues that are in the European Union, and we are interested in looking at sweet taste preferences
Mm,
across different cultures and regions and how that can impact whether or not people show addiction to food and whether or not that can affect people's relationship with food. And so I think it's really, to me, an interesting and powerful study because we kind of know what's going on in the United States. There's been lots of studies that have looked at food addiction. We've conducted a lot of those studies, and painted the picture of what's happening here in the sense that, yes, many people are struggling with food addiction, and that's driving a lot of this compulsive behavior and a lot of the intake of ultra processed food. But in countries where there's, like we've been talking about, less access to those types of
mm.
foods, or there's less of an emphasis on it, are we able to kind of see that shift happen over time when a lot of these ultra processed foods are starting to be introduced into those countries? And so that's really the crux of the study. Where, like I said, we just wrapped up our recruiting, and so we're in the process of analyzing our data, and hopefully we'll be able to present it at a conference in the coming months. But I'm excited, and I think it's, for me, I do believe that we need to start doing more research that's looking at these questions from a global standpoint,
Mm.
because this is not a US problem anymore,
Yeah.
right? This is a world problem. And I think that we've you know, really been amiss in the sense that a lot of the research has just been focused on individual countries. And I think we need to start doing a lot more international collaboration. So I'm excited about this work, and I hope it leads to more studies along these lines.
Yeah. And we so from our perspective when we were building our platform and our tech as well, the fact that you talked about that this is looking at the world data, right? It's relying on global organizations. It's one thing that we started considering was if you World Health Organization, for example, WHO, they have tried to do as best as they can, getting a lot of the message out, is the ability for us to put that data within our platform and say, for example, if somebody scans a barcode, what does the World Health Organization data say about that specific item, right? And make it easy for people to understand. So going back to the education piece too, right? So red, yellow, green. Hey, if something is 6 out of 10 or 7 out of 10, it's a yellow. 8, 9, it's a green. Below 5, it's a red. And why is it so? Right? It's not just, hey, you shouldn't eat this because of it's it's junk. Well, you shouldn't eat this because its label says, or the World Health Organization data says, it's ultra processed,
Mhm.
or the fat content or the sugar content, right? So to empower people and looking at the data from a global perspective and bringing in the data from organizations that have done it really well is important. From your studies perspective, do you, and again, we look forward to seeing the data. Now, you say the recruitment is done and now you're analyzing the data, but from your personal approach, personal perspective, can taste predict or cause, for example, overconsumption?
Yeah, oh, absolutely. We've actually done some research studies looking at that. And one of the things that we've found, going back years ago when we actually did these studies in lab rats, believe it or not, was that it's the sweet taste, not the
Mm.
consumption, the actual digestion, but the actual taste. So just it hitting your tongue is a significant amount of dopamine being released just in response to that. And so when you couple that with the reward that you get
Mm.
from the post-ingestive effects of the foods, then you get an even amplified reward. And so, yes, the taste alone is a significant component. And, that's why I have some concerns with artificial sweeteners and non-caloric sweeteners. People will often ask if I believe those are better than sugar. And the reality is, I don't think they are. I think that
Mm.
they're kind of like the GLP-1 drugs. They're a tool. If you need to use, a low calorie or a 0 calorie sweetener in your coffee to get yourself off of sugar, okay, do it for a little bit, but the goal should really be to reduce your dependence on sweetness. And I think that's the problem that we're seeing, is that when we introduce these alternative sweeteners, they're sold to us as being the cure for our cravings, because you can now
Yeah.
indulge and not worry about the calories, and they'll, be good for you. But they're not affecting the addiction in the sense that they're curing it. They're actually just perpetuating it. So if people want to kind of break free from that addiction to food, you really do need to reduce your dependence on sweetness. And this again is a bit of an American thing, right? Because I have so many friends that come from other countries or move here, and people will, one of the first things they say is, how come everything's so sweet here? Why is your bread sweet? Like, we just haven't. So our palates have been trained up to be wanting things to be really, really, really sweet. And again, I think we need to work on reducing that, because that's one of the issues that's driving us to have these addictions.
Our palates have been hijacked. I think,
They have, yeah,
it's pretty much the
pretty much.
the essence. Yeah, the essence. Um, the so your study, how long is the analysis going to take in your mind?
We should be wrapping it up pretty quickly. I think we're in a good spot. I'm hoping within the next couple of weeks we'll have that kind of all sorted out, and then we'll be able, to take a look at what we have. And like I said, the goal is always to try to shop it at a conference, right? You show your data to some colleagues at a conference and get some feedback and see what people think, and then hopefully, if all goes well, we'll be able to write something up to publish it. But I think that, like I said, really, I truly hope that this is the beginning of a longer standing type of research that we do, because I
Yeah.
do think we need to have, comparisons to other countries, because other countries are doing things differently.
Mm.
And we can learn about what's working or not based off of what other countries are doing, and comparing them to what we're doing here, I think can really help us all around.
Got it. Got it. Yeah, we look forward to obviously seeing the results and obviously sharing it with our members and our the listeners and audience as well. All right, let's discuss on a different path now.
Mhm.
If someone feels trapped in well, let's talk cravings, right? I mean, sugar cravings, are they real? Are they more imagined? And if they are real and somebody does feel trapped in those sugar cravings, what is the first realistic step that they can take? What is the first thing or first few things that they can do towards breaking from that cycle?
So I look at cravings as being in one of two categories, and they're both very real. Okay.
Mm,
The first category is a nutrient craving. And so this would be the type of craving you might have if you've gone, let's just say you've had a super busy day and you didn't have time to stop and have lunch. And now it's like midday and you're really craving something to eat. You're feeling the
mm,
hunger, right? You feel like you need something to eat, right? So that's a craving that is nutrient driven in the sense that it's your body's way of telling you you need calories. There's also other types of cravings that are nutrient driven. Like, for example, if, I don't know, maybe if all of a sudden you're like, I just really want to have hamburgers for dinner tonight or some sort of beef meal for dinner tonight. Maybe that's your body's way of telling you like you're a little low in iron, you know? So there are nutrient driven cravings that we all experience, and that's
mm.
completely normal and part of the appetitive process. And it's very adaptive. But then there's this other type of craving that I think we more often experience, and that is a hedonic craving. That is the craving for just the pleasure that you're going to get from the food. It has nothing to do with the calorie content, nothing to do with the nutrient composition of those foods. Merely, it's about the pleasure. And so when you go to a restaurant and the server comes over after you've had a big meal and says, "Oh, would anyone like dessert?" There's always room for dessert, right? So we have a hedonic craving, right? Like you could go for a slice of cake or ice cream. And so that's what a hedonic craving looks like. And I think what we are seeing more and more is that people are conflating the two. Many people have never experienced, fortunately for them, but many people have not experienced an actual true hunger craving. I've worked with so many people who have, maybe for the reasons that you talked about earlier when you were talking about how your mom would say if you were hungry in the car, like, all right, well, you'll eat when we get home after I cook you something. I feel like there's a lot of people these days who have never experienced that because if they said they were hungry in the car, mom is going to stop and get them a sandwich or get them something from the drive-through, right? And so a lot of people will pre-eat or eat because they're afraid they're going to get hungry or so they don't get hungry, like as if being hungry is some sort of death sentence. Like you could go for quite a while without eating most cases before something bad's going to happen to you. So I think that a lot of the hedonic cravings people in their mind interpret as being actual nutrient cravings, like their body is telling them they need something. And so that is then, I guess, elevated by the food industry because then, you know, we have the advertisements, we have the marketing, we have the logos, like all of these things that kind of fuel the cravings, if you will. And so I think that's the challenge that a lot of people face. And I talk about this a lot in my book, Sugarless, about how do you identify these situations and these cravings and how do you, you know, de-escalate them? Because sometimes it is really a matter of just thinking it through and saying, you know what, I actually, yes, I want it, but I don't need it. And my body doesn't want it. My health doesn't want it. So I'm going to say no and kind of working through that. But it's not always so easy. And it can really be a challenge for people who, you know, like I said, have really never experienced like true nutrient cravings.
So basically, try to identify at that time from in real time, for example,
Mm-hmm.
and say, "Hey, am I hungry, or do I think I'm going to be hungry? So let me get ahead of it." And even if you are getting ahead of it, try to figure out what is the best alternative to feed that hunger,
Mm-hmm.
rather than, to your point, the hedonic pleasure or hedonic craving. I absolutely love that, which is again the hedonistic mindset just propels you to say, no, 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 I got to get it right now. I
Mm-hmm.
got to take care of this problem or this desire, this need, this craving right away. And I think the ability to even just identify which one is what could probably go a long way in helping a lot of people just
Mm-hmm.
right off the bat like that.
Yeah. Yeah. And I think too, when you start to sit back and just ask yourself that question, like, am I hungry or do I just want this?
Yeah.
That's a big question. And, if it's that you just want it, well, okay, why do you want it? Because it's going to
Mm.
make me feel good. Well, why do you need to feel good? Or could something else make you feel good? Like, that doesn't involve like 500 calories.
Yeah.
um,
Yeah.
so again, I just think it's about like, and this is why I think the GLP-1 drugs have been helpful in that sense, in that it's about like making a pause so that people can then ask those questions. Because if you think about it, I mean, these foods don't allow us, like, that's not, addiction works very differently. Addiction, there's no like rational part of our brain that's able to then intervene. When we're addicted to something, that gets cut off. The prefrontal cortex is the part of our brain that's the rational part. And when people are addicted to something, the connection between the prefrontal cortex is weakened. And so, the rational part of the brain that says, hey, wait, stop, wait, let's think about this, it gets silenced. And so I think the GLP-1s can be helpful because they allow the prefrontal cortex to speak up again and allow you to then say, okay, let me listen and think about this for a minute before I jump into this decision. So that's where I think that, and you don't need a GLP-1 drug to do that. You could do it on your own. I mean, you can work and train yourself to really say, okay, I am not going to give into this. I'm going to give myself a few minutes. I'm going to think about this. I'm going to ask myself these questions and decide for real if this is what I really want to eat. If I'm hungry and I want to eat this, or if, maybe you're not even hungry and you're just like, you know what, I want to actually treat myself to a little piece of cake or whatever it might be. Okay, fine, or go for it. But having the control, I think, is the key element. And when you have control, then you're free. When you don't have control, then you're a prisoner.
Yeah, yeah, I completely agree, and to me, if I'm understanding it correctly, is the goal is not to remove pleasure of food or pleasure
Mm-mm.
of what you enjoy eating in moderation, or your taste buds crave, but it is to sort of modify what will bring you pleasure, and retrain our brain to crave better, for lack of a
Mm-hmm.
better term. So I'm curious, are there any, and again, it goes back to the brain chemistry, it goes back to the body's response. Are there any foods that would help the dopamine response, that could teach us to crave better? Are there any things like that, or is there anything like that?
I think it's really more about, what we can do to kind of quiet the dopamine tone, because a lot of the
Okay.
foods that we eat, like the processed foods, for example, they're very rich in added sugar. So that's going to send the
Mm.
dopamine alarms off. The things that will allow us to kind of quiet that will be things that have protein, things that have fiber. That's going to cause us to feel full and satiated. And that's going to then, mitigate some of the just impulsivity associated with the dopamine release. And so I often recommend people really try to focus on foods that are going to make them feel full, that
Mm.
aren't going to be sweet. And so, just to give an example, for breakfast, my go to for breakfast is eggs and an avocado, or half an
Mm.
avocado. Because that, and I do this, even I've had experiences with people who have children who, struggle when they get to school in the morning, and the teachers complain about their behavior and, say, oh, they're jumping out of their seat and, they seem like they're just wired. It's often tied to breakfast, because if you send your kid off to school with a bowl of sugar-filled breakfast, or, something that's got lots of sugar in it, not a lot of fiber and not a lot of protein, the sugar is going to drive their behavior, and then it's going to kind of make them ornery once it wears off. But if you can give them something that's going to keep them a little bit more even in terms of their blood sugar and in terms of just feeling full, then their behavior is going to be more even.
Mm.
So I really think it's important to kind of think about the foods that you're choosing at meals with that in mind, of, what is going to, yeah, it's going to taste good. And then, I'm not saying you can't have something sweet. If you want to have like a little bit of orange juice or something along with that, that's fine. But you're like primarily including something in the meal that's high in protein and high in fiber and high in good fats, right? And that's going to help to kind of attenuate that dopamine spike.
Perfect. So this morning when I fed the kids boiled egg and a banana smoothie with some almond powder, that should that
That's
should
great.
that should
Yeah,
be
it should
good
be
for
good.
their
You should get a good report from the teacher.
from the teacher. Yeah. Hey, he was perfect in class. I'm like, all right, it's the boiled egg. No, but you're right though. I think it goes to the next generation, right? That are we raising the next generation of responsible eaters and mindful eaters and the ones that are going to pay attention to what's important, or are we repeating the cycle of, hey, just because it's happened like this for the last 25, 30 years, and let's just continue it and make it worse, right? So I think that's where it becomes important. Now, a quick question on lifestyle. When you talk about, us as adults, obviously, uh, stress, the daily stress of work and family and all that. Does stress or lack of sleep, exercise, do they have a role to play in sort of the sugar impact or sugar cravings and the taste modifications?
Oh, absolutely. Absolutely. Stress is one of the biggest contributors to overeating. And a lot of people will turn to sugar rich foods as a way to self medicate their stress and anxiety. I would say, the most widely used drug out there to manage anxiety is sugar.
Mm.
And so a lot of times, again, we all have stress. Like, life is built around stress. Like, we were designed to be stressed a lot. That's part of how we work. It's okay to have stressors, but we have to have the ability to manage them and to respond to them appropriately. And so, yeah, like, you're always going to have like 50 emails coming in, but if you manage it in a way that you're like, okay, I'll deal with it. Or if you get overwhelmed by it and then you have a different stress response, it's going to provide two different situations. And, one of those situations might lead you to then want to distract yourself or manage your anxiety by then maybe eating something with a lot of sugar in it, because guess what? Sugar's really good at making you feel good, which is temporarily going to mitigate your anxiety. And then it becomes this vicious cycle that people find themselves trapped in, where they get stressed, they go to sugar, sugar makes them feel better, they get stressed again, and they keep going back and back. And so I think that when people kind of look at these things, especially stress, and, really consider how they're reacting to stressors, and if they find that they're like reaching for food more so than, reaching for other solutions or other perspectives on how to manage stressors, then that's a red flag. And that's something that you want to be mindful of, because when you use food to soothe yourself, it can really be dangerous, because we end up finding that, we're not, unfortunately, we don't soothe ourselves with like broccoli and salad, right? That would be great. I wish that was the case, but
Yeah.
it's usually the foods that are not really good for our health. And over time, it can add up and it can be detrimental.
Yeah. It's what we have noticed, or what the feedback that we've gotten from a lot of our members is the daily stresses, right? You're at work, to your point, emails are popping in and all that. And as part of our, overall work with our members, one thing we focus tremendously on is the behavior response and the so-called pockets of control
Mhm.
throughout the day, right? So hey, stuff's coming in. It's not going to stop just because you go eat a donut.
Mhm.
The emails are still going to be there,
Yep.
whether you eat the donut or don't eat the donut. But what can you do to disconnect for, let's say, 10 minutes? Can you do box breathing or just go out for a walk, right? The moment you feel that, can you get the nudge to say, hey, I'm just going to go for a 10-minute walk and I come back? Again, it's still going to be there, but I've sort of not necessarily reset my system, but I've slowed my system down to say, okay, got things under control. Now I'm going to go back to what I was doing and,
Mhm.
try to repeat that and make that part of your daily routine. And I think that's really helping out the responses that our members are getting for their overall health, and specifically blood glucose responses post meal or during the course of the day.
Yeah.
Um,
I'll add to that with the concept of emotion focused coping versus problem focused coping. I think that a lot of times people use emotion focused coping to deal with stressors. And so emotion focused coping is
mm,
basically when, you're focusing on the emotions that are linked to the stressor. So, if like, let's just say you got in a car accident and now your car's like banged up and you have to go get it fixed or whatever. You could complain about it. You could cry. You can, why me? Why do I have to deal with this? Like, oh, or you could just go get it fixed and deal with the problem and take the emotion out of it, or minimize the emotion. And I think that's, again, a big thing when it comes to food that people don't always do, or when it comes to stressors that people don't always do. When people, like we go back to the email example, yeah, you got all these emails coming in and that's stressing you out. And so instead of saying, okay, I'm going to deal with that by, escaping for a minute with food, maybe you need to get like the IT person to come help you figure out how to like fix your inbox so that only important things pop up and you can filter things, or you can unsubscribe from things, or what can you do to deal with the problem? I think that's important, because I think a lot of times we don't deal with the problem, or we don't like try to deal with the problem, and we just focus on the emotions, and the emotions are what's driving us to eat.
Agreed. So if I were to ask you, what is the one myth about sugar that just drives you bonkers? And you hear it either from people in media, in books, the gurus, so-called, of the nutrition industry. What is the one myth that just makes you absolutely crazy?
Yeah. So I do hear this more than I should, and it really bothers me when I hear it. And that's that if you're trying to cut back on sugar, you have to cut back on all sugar, including things like fruit. So like you shouldn't eat apples, or you shouldn't eat berries. And I hear that, and I do really just want to like grab a pillow and scream, because it's really frustrating, because, and I blame the food industry in some way for that. I think that might be some clever person in PR came up with like, oh, let's lump sugar as like it's all or nothing. Like it's either all sugar or no sugar. And if people are going to say all sugar is bad, then that means that, okay, you're saying fruits are bad. So that's going to sound crazy. So then, no, we could cast doubt. I think that's what happened. I think that's how that message got inserted into the conversation. But the reality is, no, you don't have to walk away from fruit. Fruit is an excellent way to deal with sugar addiction, because if you eat an apple, you're going to get a little bit of sugar that's naturally occurring, a small amount of it relative to a candy bar, but you're also going to get fiber, you're going to get vitamins, you're going to get other nutrients that are important for your health, that are packaged with that sugar in a way that is healthy. So I am all for people eating fruits. The one thing I'm not for is people juicing. And I'm less for people making smoothies. And again, I know you gave the kids a smoothie this morning, but that's okay. But a lot of times when you juice things, you're stripping all the fiber and a lot of the nutrients away. So that's, just not a good idea. You should really try to eat the fruit. The only reason I'm against smoothies is because I've seen people online create these like massive smoothies with like, 2 bananas, like a handful of strawberries, an apple, all kinds of stuff. Like you throw all this stuff in and you make this massive shake, and it's a lot. I mean, if I told you to sit down and eat all that fruit,
Yeah.
you couldn't do it. Your jaw would be tired. Like there's no way you could chew all that fruit. So I think that, if I had to rank order my preference, it's like eat your fruit, the whole fruit, right? And if you have to make a smoothie, go for it, but make a small smoothie or split it amongst the crew.
Yeah.
And the juice, again, I really like, that's to me on the same level as like sodas. It's just, you're better off making a different choice.
That's interesting. Yeah, I mean, the more I think about it, by the time, if I were to make juice, or when I've made juice at home, the pulp is the fiber, and I go, well, it's trash. It's kind of the dumpster, right? So I just took away probably one of the better parts of that the food, and just got rid of it. And as you were saying, fruits, and the reason I did a fist bump, I'm actually, believe it or not, I am addicted to apples. And it's the weirdest thing. Everybody makes fun of me. My family makes fun of me because every night after dinner, I have to have an apple. I don't know why that is. I don't know how it came about a few years ago, but it's like always, and it's Honeycrisp apple.
Mm,
That's my favorite one, right? So always have a basket of apples. It goes in the fridge in the morning. I like cold apple, and after my meal, I've got to get my apple. So
mm.
when I'm traveling, I've got to have my apple in my backpack too. So in a hotel room, I'll put that in the fridge. When I get there, and the next day or whenever I can, I'll have that apple. So I'm glad that I have that addiction, and
Yeah,
it's just one apple. It's every day, and maybe it's that, hey, an apple a day keeps the
yeah.
doctor away. Growing up, it just keeps repeating in my head. I don't know.
Yeah, but that's an example of like a good routine, like a good healthy habit that like you enjoy. You seem like you enjoy doing it. It's, your little thing, right? And I think that if we all could kind of just get one habit like that or work on incorporating that, then that's going to be great. And then, from there, it's just about, making smaller changes and adding things in and just, little things like that can really make a big difference.
Yeah, no, that's true. Well, this was fantastic. Thank you for sharing your perspective and connecting for us, or the connecting the dots for our listeners between your cravings, behavior changes, small sort of incremental improvements that people can make. But before we wrap up, I'd love for our listeners to know, where can they find you, follow your work, how can they connect with you, uh, uh, get your book. I
Mm.
know I've read it, but how can people get to it and get to know your work?
Yeah, so if you want to learn more about our research and the things that are going on that we're doing, you can go to my website. It's drnicoleavena.com. You can also follow me on social media at Dr. Nicole Avena. And my book, Sugarless, is out in both paperback and it's out in hardcover. And it's a great resource for people who are interested in just learning how to reduce their dependence on sugar. It's not about cold turkey quitting. It's not about never having sugar again. It's about the psychology of how we eat, why we eat, and how sugar has kind of infiltrated that. And so you can get that anywhere books are sold, is on Amazon, Barnes and Nobles, or you can go to my website and order it there too.
Folks, I urge you, if nothing else, you got nothing else from this podcast, go get that book. I've read it. Again, it's incredible. It really did change my, or solidify some of the perspectives that we had as we were building this company, and also change some of my approach on how we're building things that heal in the future. And as all of you know, we believe freedom and understanding um, is the key to long-term sustainable health improvement, diabetes reversal. And today, Dr. Avena helped us see that first step toward better health begins with the brain, begins with the understanding, maybe modifying your chemistry over time. So thank you for being with us, listening to Five Rivers podcast, and thank you for tuning in. Dr. Avena, it's a pleasure to meet with you, and thank you for your time.
Thank you.